Hey everybody, Nick Espinoza, your chief security fanatic here. Don't forget to subscribe. And today, we're talking about the FDA, or Food and Drug Administration, here in the United States, because they have an AI internally, and it's actually creating fake studies. So yeah, we're all gonna probably die. So here's what's going on. Now, I want to talk about what's happening, but I also want to talk about the process, basically how the FDA approves drugs through its trial process. It's a long and convoluted situation and system, but it has a lot of checks and safeguards in place. And so it is deeply concerning if an artificial intelligence is going to circumvent that in any which way, shape, or form, or give a false impression. So let's basically start with Matt Novak's article in Gizmodo on this as a primer. So let's start paraphrasing, because the Secretary of Health and Human Services, RFK Jr., essentially is making a big push to get the agencies under HHS, like the FDA or Food and Drug Administration, to use artificial intelligence, basically large language models, generative AI, etc., etc. So in an interview recently, Kennedy, talking to Tucker Carlson, said that AI would soon be used to approve new drugs, quote, very, very quickly, end quote. Not really a fan of that. So a new report, though, from CNN confirms what could possibly go wrong here, right? So the FDA's AI tool is known as ELSA. It's essentially, as I mentioned early on, just basically spitting out fake studies. And so CNN spoke with 6 current and former employees of the FDA, 3 of whom who have actually used ELSA for work that they described as helpful, like creating meeting notes and summaries, all that kind of stuff. But 3 of those employees, speaking to CNN, also said that ELSA just made up non-existent studies, something that we refer to in the AI world as hallucinating. So the AI basically would misrepresent research, according to these employees. Quote, anything that you don't have time to double check is unreliable. It hallucinates confidently, again, according to one of these FDA employees. And so with that, let's dive in to essentially the FDA approval process and why this process is beyond important to our well-being, aka not killing us when we take prescription drugs. So at a high-level overview of this, the FDA follows a multi-step process to approve a new drug or medication for use in humans. Here are the steps it takes to get a drug from creation to market to ensure that it's safe for the general population. The first step is preclinical testing. So you're a pharmaceutical company, and before you're testing it on humans, the drug is tested in laboratories and on animals to evaluate its safety, its biological activity, and dosage levels and limits as well. From there, it goes into what's called the Investigational New Drug Application, or IND application. So if preclinical data looks promising, the drug sponsor then submits an IND application to the FDA. This allows the drug to begin human clinical trials, assuming the FDA has actually accepted that data. In other words, they've looked at it, they've confirmed and says, yeah, you're probably not going to murder a whole bunch of humans in a clinical trial because you've done your due diligence. So let's get to stage number 3, which is clinical trials. This is the human testing side of it. But clinical trials are actually done in 3 separate phases. Phase 1 tests basically safety and dosage in a very small group of healthy volunteers. Phase 2 evaluates effectiveness and side effects in a larger group with the targeted condition. So if it's taking care of, I don't know, some condition you have, you would start to get that if you were in this trial in phase 2. Phase 1 is people that don't have this to make sure it's not going to kill you, right? So once they've gone through phase 2 with those people with the targeted condition, then phase 3 confirms the effectiveness, monitors side effects, and compares with existing treatments in large populations. So assuming all of that goes well, it's checking boxes, clinical trial, everybody's not dropping like flies or getting worse, we go to stage 4 of the overall process, which is the New Drug Application, or NDA. So if a clinical trial, or the trials rather, all 3 phases are successful, the sponsor then submits an NDA, a new drug application, with all the data from the testing, all the way from preclinical through clinical trials. The FDA reviews this to determine whether the drug is safe and effective. And so by virtue of that, we then go to stage 5, which is the FDA review. Their experts are supposed to evaluate the drug's benefits and risks, the labeling of this, the manufacturing quality, and on and on and on. This review takes several months. You don't go from preclinical to clinical to a new drug in like 6 months. This is a years-long process overarchingly that I've already described. And this basically phase 5 or stage 5 takes months alone. And once they go through that, and assuming everything is copacetic, everything's good, we go to stage 6, which is not the last stage, but it is FDA approval. If the FDA is satisfied with this evidence, then the drug is approved for marketing within the United States. And remember, this is only in the United States. Canada's going to do their own thing. The Europeans are going to do their own thing, and on and on and on. So if you're a drug maker, you're simultaneously or almost simultaneously trying to go through all these trials. And so you could be approved in Europe, but not approved in the United States, or vice versa. And these are the kinds of things that we see crop up in basically these trials as well as drug approvals. Now, the final stage beyond approval is stage 7, which is post-marketing surveillance. And basically after the approval, the FDA continues to monitor the drug for long-term side effects to see if it's affected the general population, safety issues, or quality problems. Remember how I said before I started all of these phases, they're trying to make drugs safe for the general population. There's always going to be a subset of humans, for whatever reasons, genetics, whatever, that cannot essentially take this drug or will have adverse side effects. So, for example, when I was in college, I had a professor whose wife basically was very fit in her like late 20s, early 30s, that basically ended up getting a heart attack as a result of her birth control. She was one of the 250,000, 1 in 250,000 that could possibly be impacted by that. So the general population, statistically speaking, is what all drugs cater to. And obviously that's why they're monitoring for side effects, post-approval, all those kinds of things. So here's the thing. If an artificial intelligence is hallucinating or making up reports on any of these early stages, including the aftermath of clinical trials, that's a very serious issue. Imagine if it just basically said, oh yeah, we had this preclinical trial and it was great when the test showed otherwise as the FDA is reviewing it, or maybe it misinterpreted. Right? Maybe the human-generated reports through any one of these processes, which are super important processes to ensure safety, maybe it's reading it wrong, especially let's say it's creating a summary for the actual FDA officials saying, hey, it's A-okay, when the humans that actually wrote this are warning of negative results or possible bad reactions in combination of drugs or, whatever that may be. And so this is a very serious issue. There are some things that should not be left to artificial intelligence. I can't tell you how many times I've been in a meeting and somebody says, oh, I'd like to turn on my AI note taker, et cetera, et cetera. And I'm like, yeah, that's totally fine. Just send me a copy of it. And I usually read those because I want to correct the record. And there are multiple times when I receive this, I'm like, I didn't say that. That's not what I meant. And I correct the record. But if the FDA, who is going through a bazillion drug trials and is now understaffed, and from what I understand, they've fired quite a lot of people at the FDA, they may be using this artificial intelligence and then trusting it. AI historically sounds authoritative. Studies have shown, I've talked about this, on YouTube and podcasts, on my radio show, that people, as they are getting the results from an artificial intelligence, look at that as gospel. They see it as authoritative, and therefore they trust the results. In the same way that the first few hits on Google, historically speaking, and studies show have been the most trusted results that you're going to get on a Google search. And so here we are. This is a huge, huge issue. Basically, the FDA is there to safeguard the entire process of bringing a drug to market. It's why we don't let Pfizer basically say, hey, we created something and you can go get it at Jewel or your supermarket or Safeway or whatever, wherever you shop next week, Vons if you're on the West Coast. That's why we have these things. This is a huge issue. So I'm hoping that they're going to pump the brakes a bit on artificial intelligence, slow it down, basically order the humans to put eyeballs on this and actually read and interpret the results for themselves. They're the actual experts, and they're not flying through this, making causal connections that aren't there, or just simply making things up. And if they are, they can be fired. You can't do that with an AI. And while the AI will improve over time, it's definitely not there now. So I'll leave it at that. That is essentially your deep dive of the week, and I'll see you on the other side. And please like, share, follow me here on Facebook and Twitter at NickAESP, and please feel free to subscribe to me at YouTube as well. And as always, stay safe, stay online, and please attempt to stay private, informed, and secure. Take care.